Hey all, I'm Amethyst with Sullivan Physical Therapy, and today we'll be talking about if Kegels are right for you. I wanted to talk about this because oftentimes on when I'm with someone's first visit, they'll ask, "Oh, should I be doing Kegels?" Or "I was told to do Kegels," or "Are you going to teach me how to do Kegels?" And that is a loaded and complicated answer. Sometimes, yes, sometimes Kegels are very appropriate, but more often than not, I would say Kegels might not be appropriate upfront or immediately, or might not be the only exercise that you should be doing. We'll discuss how and things to look for if Kegels would be appropriate for you, but I would like to preface that and, of course, say we hope that you meet and discuss with your pelvic floor therapist if that's the right thing for you. Um, but also because doing an exam can give us a really better picture and idea of what's going on, if they are right for you. But we'll go ahead and talk about what clues or things might you consider starting on your own if you feel like that would be helpful, or at least talking to your doctor or therapist with. But I tend to think of what's going on with pelvic floor function in two realms. What's too tight and what's too weak. Usually, if it's exclusively the too weak, Kegels are likely appropriate. There are some people who also fall in the middle of too tight and weak, and sometimes the Kegels can be appropriate for them too, but not always. Or we might want to work on the tightness first and then the weakness. Things that I tend to consider as too weak would be leakage when you cough or sneeze, leakage with jumping, running, or weightlifting. We call that stress incontinence because there's too much stress on the pelvic floor or in our core system that increases risk for pee to come out when we don't want it to. If that is almost the only thing that is a concern, then it's likely weakness based and strengthening is appropriate. Again, not exclusive, but certainly an indicator. The things you might want to anticipate that might not be appropriate for Kegels would be someone experiencing pelvic pain, so pain with sitting, pain whenever they jump or run, maybe leakage when they're on their way to the bathroom and they're rushing there and they feel like they can't quite make it and it comes out even though they're trying or thinking of squeezing. Those often are indicating muscles are too tight and we want to help relax them. Now, just because a muscle is too tight doesn't necessarily make it strong. So like I said, over time, it might be okay or appropriate to do Kegels, but not always up front. In addition to that, Kegels usually should be very secretive. So if you're doing a Kegel, you shouldn't see anything happening. So sometimes people come in and say, yeah, I'm doing Kegels, and I think Kegels might be very appropriate for them, but they're showing me something where they're bouncing up and down in their chair because they're squeezing their glutes together. Kegels should be done secretively, and discreetly, as if you're standing in line at the grocery store and no one behind you would see you squeeze your butt cheeks, or you're in a very important meeting and I was talking to you right now and doing a Kegel and no one would know what was happening. Because that really indicates that that muscle is strong enough to be able to hold and lift without anyone else helping out. The other question I get asked a lot is, well, I am doing Kegels because I know I'm doing them right because I can stop the flow of urine and I do them every time I pee. That's not always a good idea or choice. I think that it's sometimes very helpful for people to get a right idea of what muscles should be squeezing. But I really want to encourage people to be able to sit down and pee without any disruption of flow, because sometimes that really starts training our body that, oh, during this time, I'm thinking about squeezing and I'm not going to let pee come out rather than letting everything relax and let pee coming out freely. So do be mindful of that if that's something you've been doing. And the last thing I wanted to discuss is, should I use Kegel weights or vaginal weights? I have some here with me that I'd like to show you. It's from a brand called Intimate Rose. I really like this brand. I love their products because to me, the texture of the products is most authentic and comfortable. For example, with dilators, if they're using that to return towards sex. But in regards to vaginal weights, I like them because they come in a variety of sizes. Let's see if I can get everything set up here. So this is their lightest size, and this darkest color here is the heaviest size. They have 6 weights or options, and the texture is really smooth. It looks quite like a tampon. You would insert it. I typically encourage people to insert when they're in a kind of a seated or slouchy position. And like a tampon string, this would hang from the outside. And it's really nice indicator to be able to see, do I see that indicator move? Can I feel it lift up deeper inside of me? And it's usually good for something we call proprioception, where you might need a little bit of feedback to really feel if you're doing that squeeze correctly. And that can be really helpful for people. But usually I don't feel like Kegel weights or vaginal weights are required for someone who even needs strengthening in general, unless it's someone who is doing very extensive weightlifting, powerlifting, maybe return to marathon running or triathlons, where the pelvic floor is going to require a lot of demand and load. So we want to help train that muscle to be able to take on more load. But Intimate Rose would be a good place to check out their website, get a better idea of what that would look like. Again, it would come in 6 sizes, and it has a helpful and descriptive pamphlet inside of it where it'll talk about how to clean and maintain your vaginal weights, how often or how you should start or use if you were going to do this on your own. But again, I would encourage you to follow up or ask your provider if that might be safe or appropriate for you. So short answer, are Kegels right for me? Maybe. If you start them and you notice like, oh, I'm having more pain or I feel like my symptoms are worse, definitely please stop and talk to someone about that, because we don't want to make anything worse. And usually your body's telling you exactly what, or giving you exact warning signs on when to pause or stop. Chat with you soon. Bye.